Hello, I'm Sue Morgan. I'm the Teenage Cancer Trust Nurse Consultant and I work here at Leeds Teaching Hospitals Trust, where we run a teenage and young adult cancer service. It's based on two sites. It's based here at the Leeds Children's Hospital at the LGI and also at St James's Hospital. This is the first film in a series being made about some of the finalists in the Quality of Care Oncology Awards 2013. This film will show you some of the best practice that was highlighted by the judges, which led us to win Cancer Team of the Year award. Cancer in teenagers and young people aged 13 to 25 accounts for less than 1% of all cancers in the UK. It is the second cause of death in teenagers and young people, second only to non-accidental deaths such as suicide and self-harm. In the UK, before we started developing such services, teenagers and young adults either were in children's services or in adult services, and many of them fell in the gap and weren't treated as young people either by their disease or by their personalities. Survivorship in teenagers and young adults with cancer was often less than it was in adults or in children, and this is because many of them weren't entered on clinical trials or there weren't clinical trials available. Many young people will have experienced delays in diagnosis and there weren't the proper pathways or correct protocols for them to follow for their disease and for their age. Here in Leeds, focusing on 4 distinct areas has helped us to develop a service with an international profile. Those 4 areas are peer group support, team working, patient involvement, and finally sharing best practice. We're here at Leeds General Infirmary, where we have a Teenage Cancer Trust unit here for the 13 to 18-year-olds. And this is where peer group support really comes into its own. And today they are making bread. This is a place where there are no medical interventions, and this is where time to have social time comes into its own. And they'll often tell us things when they're not looking at us but making bread that they wouldn't tell a doctor in the privacy of a single room. All of our nurses and our staff and our youth support workers are all trained to communicate and work with teenagers and young people.
The nurses here are really helpful and nice, very kind and generous. They're supposed to go home early and they go home later if they need to help people out. They're very nice and they always have a laugh and you can always chat to them and they're there for you, like another family.
We arrange lots of events for the young people so they can go out and have a good time and maybe communicate with us in ways that aren't possible when they're in the hospital. We have a chomp and chat support group where we have pizzas. We have takeaways that come in the evening. We go to theatre, we go to the zoo, we go on sailing trips. We do all sorts of good things just to enhance that peer group support that's so pivotal to what we do. So here at St James's, we look after 18 to 24-year-olds. It's been a genuine collaboration between adult and paediatric services. It was the process of developing guidelines and pathways and protocols together that helped us to cement our relationships. And now we're a true partnership and we work well together to provide expert care for teenagers and young adults with cancer. But our collaboration stretches beyond the walls of this hospital and beyond medical and nursing expertise. Without the support of many charities, we wouldn't be able to do the work that we do now, working in collaboration with the National Health Service. In particular, the Teenage Cancer Trust have funded the fantastic decorations that you see around here and all the nice things that are here for the young people. They also fund myself and our youth support coordinator. We've also worked with Macmillan Cancer Support and Click Sergeant, who work with us, and we now have Macmillan and Click Sergeant social workers. And of course, we mustn't forget our local charities. That's Candlelighters, which is our local paediatric oncology charity, and the Emma Maltby Fund that helps to fund our learning mentors. Patient involvement is essential in everything that we do. They've been part of everything that we've designed and we've developed, even being part of developing this beautiful unit here in the physical space and the guidelines that we have to run this unit. For example, our patients have recently helped us in developing an app, so they feel supported when they're at home, having their normal lives, out with their friends. They've got an app where they can access emergency contact details, they can access the hospital, they can even write down their own blood results, and they can also write down their next appointments. We've also responded to the fact that many of our teenagers and young people, we know they don't really read emails, they don't read letters. But we do know that they text people all the time. We have mobile phones so that we can text young people all the time. And sometimes we have the most meaningful of conversations just through text. And finally, sharing best practice. We invest a considerable amount of time in ensuring that our nurses and our other workers here are equipped to treat and to communicate with young people. So it's about having the expertise of working with teenagers and young adults, as well as the expertise in their disease. And as a team, we deliver that together. We also make this expertise available to other units to help them to develop services. We share our expertise by inviting people to come and spend time with us in order to see what we do and get a feeling of the atmosphere here. We've also had visitors from and been invited to speak in the United States, Canada, and across Europe in sharing practice with them so that they can learn from us. We also provide support to other non-cancer teenage services across the hospital trust here in sharing our expertise and so that they can also benefit from what we have learned. Through team working, patient involvement, peer group support and the sharing of best practice, the Teenage and Young Adult Cancer Service in Leeds continues to provide expert care to this group of the most vulnerable patients. We would be very happy to be contacted if you would like to come and meet with us or to discuss the way in which we work so that we can share practice with you.